Hi, I'm Sophia, and I'm going to be giving you the shift report of my 4 patients over the last 12 hours. So our first patient, her name is Sarah Getz. She's in room 301, and she's a 77-year-old woman. She was diagnosed with chronic renal failure with hyperkalemia with a lab value of 5.9 and hyponatremia with a lab value of 128. Her vital signs for temperature was 98.8, blood pressure 102/76, pulse 102 with a regular sinus rhythm, respirations 22, and O2 sat 90%. She is on a cardiovascular on telemetry, and she was disoriented to time and place and has slurred speech. We did a Perla test on her, and her pupils are clear, and she has a hip lock on her right forearm, and her skin was noticed as dry and warm. She has generalized weakness, though, in her body because she had recently lost a lot of weight, and she is intaking around 50% of her food, and she's a high fall risk. For our next patient, Estelle Hatcher, she's in room 303. She's a 31-year-old woman who is diagnosed with appendicitis, and she is first day post-op from her appendectomy. We looked at her wound site and had the wound specialist nurse come in, and it was clean and dry and intact, and she's able to ambulate with minimal assistance. Her vital signs were temperature of 101.2, blood pressure 108/74, pulse 92, respirations 20, and O2 sat of 99%. She is very cooperative, and we've been working with PT to help getting her moving and recovering well. And she has NPO status and an NG tube with low continuous suction, so we can't give her any food. She's been on IV maintenance fluids with a D5 half NS saline with 20 kcal and at 125 milliliters per hour in her left forearm to help give her the nutrition and fluids. Next, we have our third patient. Her name is Ann Rails. She is in room 302, and she's a 38-year-old woman. She was diagnosed with back pain. Her vital signs are blood pressure 124/82, temperature 98.2, pulse 84, respirations 22, and O2 sat of 96%. She had been experiencing pain and numbness in her leg for a week, and she, as we have noticed, has had left leg weakness, and she has an unsteady gait. She has rated her pain on a 5 out of 10 the last time we checked on her within the last hour or so, and we did a neurostatus exam on her, and she was all good there. She has been told by the doctor and the physical therapist to do activity as tolerated and to get assistance when ambulating. And the plan for her is to help restore her normal gait and to decrease the amount of pain and get her on a regular diet because she's in a lot of pain. She hasn't been eating very well, so her nutrition status has been a little off. And then our last patient, Robert Sturgis, he's in room 304. He's an 81-year-old man, and he was diagnosed with metastasis cancer of the colon. He has a history of diabetes, and he's on palliative care. For his vital signs, he has a temperature of 98.7, blood pressure of 114/67, pulse of 115, which might seem high, but this is normal for him. We talked to him and looked at his previous charts. Respirations of 20 and O2 sat of 98%. He's alert and cooperative, and his skin, when we assessed, was warm and dry. His blood glucose, which we checked at lunchtime, was 184, and he's on 4 units of insulin with a sliding scale coverage, and he is on an ADA diet with an intake of 25% of Demerol, 25 milligrams for management. And last time we talked to him, he said he was a 7 out of 10 on the pain scale. So those the rundown of all the patients over my shift.